If you plan to support cupping and alt med, be aware that I will unsubscribe. And I will tell my friends to whom I recommend the channel to unsubscribe as well. Wow, I think that is the first time we've ever been threatened before.
Aw, we've come so far.
So far, I know. Well, all the more reason to make this video, right? There are obviously some serious misconceptions floating around about cupping, and I don't know about you guys, but I think it's time to clear the air. So cupping has a somewhat rocky origin story, at least from a scientific point of view. Some say it originated as a way to remove toxins from the body. Others noted how it was used to treat maldigestion and headaches. There's a lot of speculation about cupping, but not a lot of research, which made it appear to be more pseudoscience and less an effective tool. Fortunately for us, research has advanced and we can now use medical imaging such as MRIs to show that MFD is actually an effective tool. So while it won't cure your upset tummy, it can be a useful tool for climbers to help us recover and climb at our best. Speaking of effective tools, I have this really cool new electric dynamic cupping set made by Achedaway. I'll be talking about this later in the video, but you definitely don't need this device to perform MFD. Also, I want to be clear on this. Achedaway sent us this cupping unit for free to review and give away, and we thought it would be a good opportunity to talk about MFD in general, especially since we've mentioned it in other videos before, but Achedaway is not paying for us to make this video. No money changed hands, and Achedaway has no influence over the content of this video, and they are not reviewing it before it's published. So how does MFD even really work? Well, MFD uses negative pressure to create separation of our three main layers of tissue, like skin, connective tissue, and muscle. By separating these three layers, you can see improvements in blood flow and circulation. It can also help the three layers slide past one another easier, which can improve overall mobility, and by doing so can also reduce pain. MFD is usually used to treat general pain and muscular tension, but it can be used to promote healing in injured tissue in the later stages of healing, and it can benefit the remodeling phase as the tissue strengthens. Here are a few common issues MFD can help with. So now we know a little bit about MFD. Is there any science to actually back it up? Most of the research is in support of MFD. Now, I'm not going to go into huge details about each report because I don't want this video to be 3 hours long. But remember, I post all citations and small notes about the research in the show notes on the Hoopers Beta website, so be sure to check it out if you want some light reading of your own. Research has shown that MFD can be used to reduce trigger points, can be used to improve range of motion, can be used to decrease chronic back pain, and there's even some research that showed cupping reduced pain and improved function in patients with knee osteoarthritis. Like, for real? One article titled "Effects of Cupping Therapy in Amateur and Professional Athletes: Systematic Review of Randomized Controlled Trials" showed that different athletes from different populations and sports, including soccer, football, swimming, gymnasts, etc., and more, reported cupping as beneficial for perceptions of pain and disability, increased range of motion, and reductions in creatine kinase when compared to mostly untreated control groups. But the majority of trials had an unclear or high risk of bias. So while I include this paper because I think it's an interesting systematic review, there is a risk of bias with that paper. All right, so what about the research against it? Look, this is the cool thing. The research against doesn't really point out many flaws or dangers with MFD. Rather, most of the research against it simply suggests that MFD may not be better than standard stretching or other treatments to improve range of motion or reduce pain. Essentially, research has shown that MFD has been used to help treat trigger points, improve range of motion, and decrease pain, but that sometimes range of motion improvements aren't better than other standard treatments. In my honest opinion, I think that the research on cupping needs to continue. From the research I've seen and the benefits I've seen in my own practice, I think it is a good tool, but I think there needs to be better and more concrete evidence to stand on with regards to treatment style, duration, and other factors. Hopefully more is on the way and we can continue to learn about this tool as more information is released. There are many different forms of MFD, but I'm going to talk about just a few specifically: static, dynamic, and static with active or passive range of motion. Let's go into a few details about each type, as well as some fun variations. Static MFD is perhaps the most commonly practiced, and also really the most well-known by the lay person. It involves placing a cup in one position and leaving it there for the duration of the treatment. This is effective in creating separation of tissue at that one location. This typically creates more of that bruise-like discoloration due to the constant static pull in one spot, which pulls more blood to that spot, which will settle between the tissue layers, and then it will slowly dissipate over time like a bruise. The benefits of this technique are creating a longer, more focused release of tissue in just one spot. This is good for an injury that is more isolated to a specific area. Dynamic MFD involves placing a cup in a position and then moving the cup over other areas. Typically, this means less pressure through suction because too much suction would make it too hard or even too painful to move. This works great over areas such as the back, but it can be a little more challenging over smaller surface areas such as the elbows or forearms, especially just because the different contour of the elbow and forearm. The benefit of this technique is to work over larger areas, break up additional adhesions through the movement, and it creates less bruise-like discoloration as it does not remain in one place for too long. If you have an electric cupper like the one from Achedaway, dynamic cupping can also be considered cupping that has a constantly changing amount of suction pressure. This is a super cool technique that will alternate levels of pressure and is easy with a tool like an electric cup, but honestly much less functional with a standard cupping set, as you'd have to consistently remove and then add pressure. Not fun, not convenient, not recommended. The benefits of dynamic cupping like this are a combination of static and dynamic, as we just mentioned. It will stay in one spot, so it works on some specific trouble areas, and it creates great separation of the tissue, but it does so with alternating pressure, so it will not cause as much bruising as typical static cupping would. In this form, you would leave the cup in one place, static, but you would move through an active or passive range of motion that would benefit the affected limb or area. An example of this would be placing the cup on your elbow and then bending and straightening the elbow. For this to be passive, you would need a friend to passively move the joint for you, whereas actively would be you doing it on your own. The benefit of this form of cupping is that you are now actively moving the tissue underneath the cup while it's creating that separation. This is great at creating functional changes and can really break down any areas of fibrosis or increase scar tissue. Note, there are other forms of cupping in addition to the ones I just mentioned, including wet cupping, but the aforementioned forms are the ones that I recommend and that have more research related to them, which is why I prefer to speak on them. Also, wet cupping involves actual bloodletting. Let's not do that, okay? Thanks. So, just as a quick reminder, MFD should be used to treat musculoskeletal injuries, including myofascial pain, tendinopathies, and trigger points. MFD could also be used as preventative care to areas you've had trouble with in the past. Like an example, you could do routine MFD to the shoulders or elbows to help prevent fibrosis and development of a tendinopathy. All right, so we know about what it can treat, but what about where? Where can I use MFD? Well, MFD can be used really on any surface that it will stick to that is not an open wound or orifice. You can use it on your feet, calves, thighs, or back, hands, etc. I just don't recommend placing it on or near any sensitive tissues. Knowing when to use MFD is also important. If you're rehabbing an injury, using MFD before your submax training or rehab is a helpful tool as you'll mobilize the tissue prior to exercising it. If you're uninjured and wish to use it as a preventative tool, it can be used on a rest or recovery day. It can be used when you're feeling sore as well, but I don't really recommend it immediately after hard training or exercise. Now, what about timing and duration? Typically, you need at least 5 minutes of treatment for it to be effective, but I usually cap it out at 10 minutes per area. You can do this essentially every day if there is no bruising, but my recommendation is every other day at the max. If you're having bruising for any reason, do not cup over the area until the bruising has completely disappeared. I would also add in that in my experience, you should focus on hydration before this type of treatment, as the effects seem to be more well controlled if you're properly hydrated. So there are absolute and relative contraindications to cupping. Absolute contraindication means that under no circumstance should you perform cupping if you have one of those contraindications. Whereas relative contraindications means that it should be done under your own personal risk. The absolute contraindications are if you've had a history of cancer, those with any type of organ failure, those with the pacemaker, or those suffering from hemophilia or other blood-related conditions. The relative contraindications include acute infection, the use of anticoagulants or blood thinners, pregnancy, anemia, or recent blood donations. Let me be clear right off the bat. In my standard practice, I don't have time to do things that I don't feel will benefit my patients. I want to maximize their time and get them back to their sport as quickly as possible. I also have to find a balance of things that may help and may have limited to no cost to my patients because I don't want them to experience pain or setbacks. With that being said, how does MFD fit in? Well, in my experience, MFD has had a consistently positive effect with my patients, from helping reduce trigger points to promoting circulation and healing to treating tendinopathies and even using it as an advanced form to perform nerve gliding. I'm a fan of MFD because I have seen it help my patients. It's even a tool that I can give to my patients. I can share an inexpensive link to a cupping set that they can buy on their own, and I can teach them how to do it so they can continue their treatment independently. It's a great, inexpensive tool that I enjoy using in my practice and promote with my patients. But there have to be some negatives to it as well, right? Well, yeah, of course. The main one for me is the bruise-like discoloration it can cause. The main reason for this is just because once the tissue has that bruise-like discoloration, you cannot or should not do it again over that spot. That makes this a treatment you can only do every week or so. Also, that discoloration isn't the most attractive to a lot of people, so they don't like to do it, especially in beach bod season, living in San Diego. We also have to have some basic understanding of the technique to be effective. This can come from an awesome video like this, but let's be real, there are entire courses on MFD and cupping therapy to teach advanced techniques, so while you can definitely get the basics down, for next level effectiveness, there needs to be some training. If you've made it this far, at the end of the video, we're going to tell you just how you can win a free electric cupper of your own, so be sure to stay tuned. So as for my thoughts on this, I had never even seen one of these before, but the way it works is pretty cool. This little guy has 5 different modes and 5 different suction intensities. It also includes red light therapy, which is not something we're going to discuss in this video, but if that's something you want, this thing has it. The 5 different intensities are cycled through just by the touch of a button, and the 5 different modes include 1 static mode that maintains the pressure you want, and 4 other programs which vary the speed and consistency of the suction pressure. So here's my breakdown of the likes and dislikes about this product. The first thing I like about this is that it stays on way better than normal cups. Oftentimes regular cups will start to fall off because they might lose their suction, but this guy automatically adjusts if it is losing some of the pressure. Say you want it to be at like 80% and it starts to lose some of that, it'll just pump itself right back up to be at 80% again. So that's a great bonus over regular cups, which not all the times, but sometimes will lose some of that pressure and then just eventually fall off. Now, because the pressure is more intermittent, it also doesn't cause as much bruising. This is actually a great feature because, like we mentioned before, bruising is a contraindication to cupping, meaning if you have an area that is bruised, you need to avoid cupping that area. With this device, I can use the cups 2, 3, 4 times a week because I'm not getting bruised. With traditional cups, I typically would only be able to do it once a week, and then I have to wait for that bruising to decrease or be eliminated. Now, the 5 different intensities are also awesome. Some areas are more sensitive than others and vice versa. And it's awesome that you're able to modulate the intensity based upon your needs. It can also allow me to become less sensitive and then ramp it up. I may only start at level 2 on certain areas, and as it becomes better, boom, hit that button, level 3. What about if you accidentally leave it on? No worries, this thing will automatically turn itself off after around 15 minutes. It also has a convenient Type-C port on it, so it will convenient for Pixel users like me because I can just charge it on the same cable I charge my phone, and I have chargers all over the house, so always power. I also like the aspect that this cup is removable. Not only does it make it a little more convenient for transportation, but it also makes it a lot easier to clean. I also like that it's removable because that means in the future they can come out with smaller or larger attachments, so you have different cups you can use on different areas. The size of the cup is so far my absolutely biggest gripe about this product. It's only this one size, which means it doesn't fit on smaller areas which are needed for climbers, especially because one of the main areas for treatment would be the elbows. I have to bend my elbows to create more surface area for it to stay on, or if I try and straighten my elbows, it'll fall off. On the flip side, it would also be cool if they had a bigger cup for the larger surface areas such as the back. The medium cup they have is obviously best for most cases. I just wish I had more sizes I could work with to use on all body parts more conveniently. All right, well, my second biggest gripe about this is the price. A regular cupping set for 12 or 24 cups will cost $20. Really inexpensive and easy to attain by most people who want to try it out. These Achedaway cuppers, on the other hand, are about $170 each. If you're a professional athlete or if your profession involves using cups like this, it can be totally worth it, but for a lay person, it might be a bit pricey. Now, this is electric, so it does make some noise as well. And while it's not a consistent noise, so it's a little more distracting than a regular cup would be, which obviously makes no noise. Now, I also mentioned the auto off is a really cool feature, but it's honestly a little fast for me. I think the timing is a little quick if you're using it for multiple body parts. You may actually want it on for longer, but you can't stop the auto off. It doesn't recognize that you're still using it and restart the timer, so it just turns off in the middle of treatment sometimes. Honestly, I kind of love this electric cupper compared to regular cups, heavily based on the fact that since it is dynamic, it doesn't leave bruising like normal cups, so I can use it more often if needed. If they weren't as expensive as these are, I would buy more myself because they are fun and superior to regular cups. So in general, I think this Achedaway cupper is a great tool. To me, it's simple yet highly effective. So in summary, MFD is not the pseudoscience many people seem to think it is. It's actually a great, simple technique backed by some good scientific research to help with a spectrum of issues ranging from tendinopathies of the elbow, chronic pain in the back, trigger points in the shoulders, or even neural entrapments. With a bit of understanding and education, you can effectively perform this therapy to help recover from injuries from the comfort of your own home. So that's it for this video. And until next time.
Whoa, whoa, whoa. You forgot about the giveaway details.
Darn it, I thought if I didn't say anything, I could just keep it for myself.
Yeah, you would.
We're giving away a brand new unopened unit to one subscriber as a thank you for supporting us, and a big thanks to Achedaway for providing an extra cupper for us to give away. You do have to live in the continental US for this one, so apologies to our beautiful international family. So if you're in the lower 48, all you have to do to enter is subscribe to us on YouTube, follow us on Instagram at HoopersBetaOfficial, leave a comment on this video, and we'll pick one eligible subscriber at random to give the unit to. The giveaway starts when this video goes live and ends 14 days later. All right, can I say it now?
It's my time now. Get out of here. Train, climb, suction.
It's sin, bro.
Repeat.
Oh wait, you probably see the remote that way. I was like, wait, which chat box is it? And I don't know about you guys, but I think it's time to clear the air.
Well, that intro sucked.
I didn't know that was your line. I get it. I was literally like, dude, all right, I guess we'll do it again. Speaking of useful tools, I mentioned earlier a cool new, I didn't mention earlier. I didn't say anything of the kind. We're like those legit YouTube channels now because we throw stuff. Yeah. I don't see, my voice is just like super dry. It like dried out at me in the end. I did talk to people yesterday, so that's different than normal. As the surface area is kind of constantly changing because it's not fully flat throughout the surface. That was terrible. As the effects seem to be more well controlled if you're properly hydrated, which I am not. I shouldn't do cupping today.
Definitely not.
I don't recommend placing it near or on any sensitive tissues, but that's your own party. It's so strange.
Dude, say something cool so they like the videos and subscribe for more awesome content.
Like and subscribe for more super sweet vids, y'all.
So lame, dude. So lame.
I thought it was pretty good.